Welcome to People. I'm Micah Mater. We're starting with some health headlines. The doctors are in. Welcome Dr. Ngozi Ezike, President and CEO of Sinai Chicago, and physician, author and founder of Simcoe Solution, Dr. Jeffrey Sterling. Thanks so much for coming in, you guys. April is like an awareness for everything, isn't it?
It really is.
Oh my goodness. Let's start off with minority health awareness. Is that the biggest thing that's going on?
It's one of the many.
It's one of many.
Yeah.
But you say, is it really still Minority Health Awareness Month, or isn't it?
Well, on the one hand, let's do it like we do the other thing. Every month should be Minority Awareness Month if you want to take care of yourself. What you're referencing is the fact that in the federal government, there's been some dissolution of celebrating or acknowledging that. So, yes, it's Minority Health Month across the country, so let's get into it and talk about what we can do to be better.
Yeah. How does that affect health care, though, that it's not being recognized by the government?
That's a great question. Actually, I'm not sure that it does, because it's on an individual basis. People have to implement the strategies that would be talked about on the governmental level. All that does is there are certain agencies, Health and Human Services, CDC, FDA, for example, that won't be promoting it the same way that maybe they've done in the past.
And Sinai, for instance, is making a really concerted effort about this, aren't they?
Well, I mean, every day is Minority Health Day. As you know, 90% of our population that we serve is Black and Latino. So we are focused on that every day. We're going, being intentional about making sure that we're hiring caregivers, that's our staff, that speak both English and Spanish. We want to make sure that we have an inclusive, welcoming environment, where people feel that we want to communicate with them and be able to give them the best care by being able to fully understand them and them us. So since last year, we've hired over 100 bilingual caregivers. And
nice.
So that's a very strong commitment to make sure that we can welcome and take care of everyone that comes through the door.
Very, very helpful when you go into a hospital. You're already feeling awful most of the time. You're like, I need somebody to help me, and there's that language barrier. So to have that is very helpful. Alcohol Awareness Month as well. And recently, they've come out with a lot of statistics about alcohol. Specifically, it's worse than we thought, right?
There simply is no amount of alcohol that you can take that is safe. Hard stop. The more you take, the higher your risk. The less you intake, the lower the risk is going to be. If you choose to do it, just be informed of the fact that you're actually literally putting poison into your body, and those choices have consequences.
Scary.
Yes.
It's so scary.
With the people who have hepatitis and liver cancer and other such things, you should have not necessarily an unreasonable amount of fear, but just be an educated consumer should you choose to do it.
What about the red wine a night is supposed to be helpful with the resveratrol and all that fun stuff?
What we know now is that alcohol is linked directly to 7 different types of cancers. We know that, not to mention the things that we know that it causes in family problems, social issues, difficulty with being successful at work, school, etc. So, we know that we have to just be aware of the facts. Like, again, I don't know that everyone's going to become a teetotaler, but we have to, I think once you're, armed with the facts, then you can make appropriate decisions. Maybe for some people that means, cutting back. I know a lot of people do the dry January.
Right.
So maybe people will have some other variations or permutations of
find out the benefits once they do that. And you guys do have a clinic to help folks who maybe have gone a little bit too far, right?
We do.
Can I say something there? Because look, people aren't going to stop drinking just because this is out there. Just understand, life is currency. There's a certain amount of currency we have in life, and you choose how to expend it, and that translates into what you call quality of life. I just want people to be informed and educated. When you choose to do this, you're adding risk. It's just that simple. Go and live your life, be happy, whatever it takes.
Okay, you made me feel a little bit bad. The Alzheimer awareness, what does that specifically entail?
So we know that Alzheimer's, we're seeing probably increased rates, especially as our population lives longer.
Older, yeah.
And so there are things that we can be doing to try to decrease our risk or stave it off as long as possible. And there are things that are pretty simple. Things like that stimulate your, cognitive function.
Like drinking,
doing
alcohol.
Like doing puzzles.
Right.
Exercise, walking briskly, sleep. I think that's an underrated but super important factor that helps so many health indices. But sleep is very important, and having quality sleep regularly each night helps decrease your risk of Alzheimer's.
And I think people don't realize that you can prevent some of the symptoms of Alzheimer's, can't you?
Of course you can.
Yeah.
Once again, I always talk about in terms of reducing risk, but what I'm really glad we aren't talking about is the expectation that there's going to become a magic pill that eradicates it. No, it's in our hands. The things that we can do, and she mentioned a bunch of them, actually decrease the risk and stretches out the time frame for which we would obtain it. If you live long enough, there are some things that we call inevitable diseases, perhaps. But you can lower your risk and slow down the onset of those things, and that's what we have to get into, how to be better stewards of our own health care to stave off disease, even the ones that happen later in life.
We've just found out that there are more measles cases that they found in Indiana, and they think at least the children weren't vaccinated. Not sure about the adults right now. Vaccination is important. It does not cause problems. Yay or nay?
Yay. I mean, the measles vaccine, I mean, we eradicated measles in the United States in 2000, 25 years ago. So we have a vaccine that's very effective, 93% effective if you get those 2 doses, and then with herd
MMR,
immunity,
right?
the MMR. But we have seen, last year, I think in all of the country, we didn't even have 300 cases. We had 200 and something cases. We are already over 600, and it's almost 100% in people who are not vaccinated.
Is it that what's causing this outbreak? People have decided they're not going to vaccinate?
Absolutely. It's easy to say, and it's accurate to say, that the cases are occurring in those that have not been vaccinated. It's just that. And, I'm glad you said it. And by the way, that's 2.5 hours away from Chicago. So
Right,
the creep
close
is getting
by.
closer. And kudos to the Department of Public Health. There have been no cases reported in Illinois since the beginning of 24. So it's not in Chicago, not in Illinois yet. But the way travel works is that it is getting circulated amongst people that have chosen not to get vaccinated.
Things that have been in place for a long time, vaccinations, also fluoride. It's automatically in the water, but we may not be seeing it in our water. You were saying Utah has become the first state that's no longer putting it in the water.
That's correct. And it's unfortunate because it's such a passive public health effort. It doesn't take very much, and it has been proven to be very safe. By the way it occurred, speaking of Utah, Colorado was the reason why we started doing it. Once upon a time back in the early 1900s, when everybody was walking around literally with rotted teeth and abscesses, it was discovered that that wasn't the case so much in Colorado because there was a natural level of equilibrium, a level that was safe enough, low enough to be safe, but not high enough to cause some of the concerns. And then the public health community decided to extend that. So now it's here, there, and everywhere. And the logic is that because we have it in toothpaste, we necessarily don't need to have it in water. Well, first of all, there's nothing that proves that adding it to water increases levels to unsafe levels. And it's a disparity that you're waiting to implement because not everybody has access to dentists and not everybody can afford toothpaste, believe it or not, across the country.
It's hard to believe. Thank you both. I always love when you guys are here. I learned so much. You can find Dr. Sterling's books and wellness resources at thesimcosolution.com, and you can find details on the services and programs offered through Sinai Chicago at sinaichicago.org.